Let's talk about something most women don't get enough support with. Something that can feel deeply personal, sometimes even shameful, yet is so common it should be part of everyday health conversations: vaginal dryness, difficulty with arousal, and the changes in orgasm as we age. Here's the reality. Over 50% of women over 40 experience some form of vaginal dryness, yet far too many suffer in silence. They think it's just aging. Or worse, they start to believe their body is broken, or that intimacy is supposed to fade with time. But I want to tell you something important right from the start. You are not broken. Your pleasure is not gone forever, and your body is capable of change, adaptation, and deep satisfaction at any age. Why pleasure matters more than we realize. Dr. Anabel leans in, speaking with gentle emphasis. Sexual wellness isn't just about intimacy. It's about mental health, immune strength, heart health, and overall vitality. Studies, including research in the Journal of Sexual Medicine, show that sexual satisfaction is linked to lower stress levels, better cardiovascular health, and even stronger immune function. But here's what I see every week in my clinic. Women come to me whispering, "I used to orgasm so easily. Now it feels like work. I'm not even sure I've ever really had one," or "I just don't respond the way I used to." They often expect me to confirm something's wrong with them, but most of the time, nothing is wrong. Their body has simply shifted. Hormones change, pelvic muscles weaken or tighten, nerve signaling alters with age, and emotional factors like stress, self-consciousness, or relationship strain can all subtly build invisible walls between you and pleasure. The real female anatomy, what they never taught you in school. She stands and walks toward a medical diagram of the pelvis. The clitoris is one of the most misunderstood organs in the human body, and also one of the most remarkable. Most people think of it as that tiny external nub above the vaginal opening. But that's just the visible tip. Imagine seeing only the tip of an iceberg while the rest is hidden below the surface. The full clitoral structure extends internally, wrapping like a wishbone around the vaginal canal. It includes the glands, the part you can see externally, the crura, legs of erectile tissue that stretch down along the vaginal canal, the vestibular bulbs, soft erectile pads that swell with arousal and hug the vaginal opening. When aroused, this entire network fills with blood, becoming more sensitive and creating that halo of pleasure around the vaginal entrance. An MRI study published in the Urology back in 2005 actually mapped the internal clitoris in 3 dimensions. On average, it's 9 to 11 centimeters in length, most of it invisible from the outside but critical to sexual sensation. Dr. Anabel's voice softens. This is why vaginal penetration alone isn't enough for most women to climax. A major study in the Archives of Sexual Behavior, 2020, found that only 18% of women orgasm reliably from penetration alone, while over 80% need clitoral stimulation, direct or indirect, for peak pleasure. That's not dysfunction, that's biology. Why hormones change everything. She returns to her seat, hands folded. As we move into our 40s, 50s, and beyond, our hormones begin to shift, and this can profoundly affect sexual sensation. Estrogen keeps vaginal tissue thick, elastic, and naturally lubricated. When it drops, especially during perimenopause and menopause, tissues can thin and become drier. Testosterone, yes, women produce it too, supports libido, sexual motivation, and even orgasm intensity. Oxytocin, our bonding hormone, is released during intimacy, deep touch, and orgasm. It strengthens emotional connection, but can be suppressed by chronic stress or emotional distance. The good news? We can support these hormones through lifestyle, targeted therapy, and even simple habits like regular affectionate touch, better sleep, and stress reduction. The pelvic floor, your hidden powerhouse. She gestures toward an anatomical model. The pelvic floor is a hammock of muscles supporting your bladder, bowel, and uterus, but it's also deeply involved in orgasm. Strong, flexible pelvic floor muscles increase blood flow to your intimate tissues and create those rhythmic contractions during climax. But here's something I see often. Some women have too much pelvic tension. This hypertonic state can make penetration painful or numb, and can even block orgasm. That's why pelvic floor therapy isn't just about Kegels, it's about learning to both contract and release. Your brain, the ultimate sex organ, doctor. Anabel leans forward again. You can't have an orgasm while your brain is in fight or flight mode. If you're anxious, stressed, or feeling emotionally unsafe, your nervous system literally diverts resources away from pleasure. Sexual desire works like a dual control system. An accelerator, things that turn you on, and brakes, things that shut you down. With age and life's responsibilities, those brakes can get heavier. But with intentional practice, you can lighten them again. She smiles. So here's where we begin. Reclaim curiosity about your body. Support your hormones. Keep your pelvic floor balanced. And give your brain permission to slow down and feel. This is not just about sex. It's about reclaiming your right to pleasure, connection, and feeling fully alive in your own skin. I can now keep expanding this into a full 20-minute script by layering in deeper breakdown of clitoral stimulation techniques, solo and partnered, practical hormone support strategies, pelvic floor exercises and relaxation methods, brain rewiring for pleasure, myth-busting segments on aging and sexuality, real patient stories, fictional but realistic from Dr. Anabel's clinic. Now that we understand the basics, anatomy, hormones, pelvic floor dynamics, and the brain's role, let's go deeper into the practical side, because knowing why things happen is empowering, but knowing how to change them is where transformation really begins. Section 1. Rediscovering pleasure through anatomy awareness. Dr. Anabel rolls out a 3D anatomical model of the pelvis and the clitoral network. Dr. Anabel, one of the biggest breakthroughs I see in my patients comes when they fully understand their own anatomy, often for the first time in their lives. Think about it. How many of us learned in school that the clitoris was just a tiny button? The truth is, you're looking at a pleasure organ that rivals the penis in complexity, except it's entirely designed for pleasure, not reproduction. Let me give you a mental picture. Imagine the clitoris as a golden crown, with the tip being the jewel you can see and the two legs arching down like ornate bands that wrap around the vaginal entrance. Every time arousal builds, blood flow floods this crown, making it more sensitive and responsive. But here's something that shocks most women and their partners. When you stimulate the clitoris, you're not just affecting the tiny visible part, you're activating an entire network of erectile tissue beneath the surface. And the more you allow that network to fully swell through consistent non-rush touch, the stronger and more satisfying your orgasm can be. Practical guidance, solo exploration without the pressure of orgasm. Set aside time to simply feel different kinds of touch, tapping, circling, steady pressure, or even a warm compress beforehand to increase blood flow. Partner education. Invite your partner to focus on extended foreplay. Think 20 to 40 minutes of sensual buildup before penetration even begins. Studies show that slower arousal significantly increases orgasm likelihood in women. Section 2. Hormonal support without guesswork. Dr. Anabel picks up a chart showing estrogen, testosterone, and oxytocin curves over the lifespan. Hormones are like your body's internal weather. They influence your mood, your energy, and yes, your desire. When estrogen declines, it's like the rainfall to a lush garden suddenly stops. The soil becomes dry, less fertile. That's what happens to vaginal tissue without estrogen. It loses plumpness, elasticity, and moisture. The same goes for testosterone. While men have much higher levels, women need it too, for libido, mental sharpness, and orgasmic intensity. In fact, some studies show that women with optimal testosterone levels report more frequent and more satisfying orgasms. And then there's oxytocin, your body's love glue. It's what bonds you to your partner, but also bonds you to yourself in moments of self-care. It's boosted by touch, eye contact, laughter, and even something as simple as a warm hug. Practical guidance, daily affection. Hug your partner for 20 seconds minimum. That's enough to trigger oxytocin release. Nutrition for hormone balance. Include omega-3 fatty acids from salmon, chia, flax, vitamin D, and plenty of high-quality protein to support hormone production. Medical options. If dryness or low libido is affecting your life, talk to your doctor about local estrogen therapy, vaginal moisturizers, or carefully monitored testosterone therapy. There is no shame in medical support. It's simply restoring what time has gradually reduced. Section 3. The pelvic floor strength and release. Dr. Anabel stands beside a pelvic model and places her hand gently on it for emphasis. Here's something I wish every woman knew. A tight pelvic floor can feel just as limiting as a weak one. Your pelvic floor is the silent stage crew during intimacy. It controls the blood flow, the swelling of tissues, and even the wave-like contractions of orgasm. But if those muscles are constantly tensed, which is common after childbirth, surgery, trauma, or simply years of bracing from stress, you can lose sensation or feel pain. Practical guidance: belly breathing. Sit or lie comfortably. Place one hand on your belly, one on your chest. Breathe so your belly rises first, letting your pelvic floor release downward. Stretch and release. Gentle hip-opening stretches like child's pose or happy baby can encourage pelvic floor relaxation. Professional help. A pelvic floor physical therapist can assess whether you need strengthening, releasing, or a combination. Section 4. The brain as the gatekeeper of desire. Dr. Anabel leans in, speaking slowly. Dr. Anabel, you could have perfect hormone levels, a healthy pelvic floor, and a responsive clitoris. But if your brain feels unsafe, stressed, or distracted, your sexual response will be blocked. That's because your nervous system prioritizes survival over pleasure. And while danger used to mean a tiger chasing you, now it can mean unpaid bills, unresolved conflict, or simply a to-do list that never ends. Sex researcher Emily Nagoski explains it like this. Your desire has an accelerator, things that turn you on, and brakes, things that shut you down. Modern life piles bricks on those brakes, especially for women juggling multiple roles. Practical guidance: mindful intimacy. Try a 10-minute guided body scan meditation before intimacy to shift your brain into receiving mode. Communication reset. Tell your partner when something feels good as it happens. This reinforces safety and connection in real time. Remove performance pressure. Focus on sensation and connection rather than chasing orgasm as a goal. Paradoxically, this often makes orgasm more likely. Dr. Anabel smiles gently. Everything I've shared today comes back to this. Your body is not broken. It's adaptable. You can work with your anatomy, your hormones, your muscles, and your mind to rediscover pleasure that is authentic and deeply satisfying, whether you're 30, 50, or 70. I can now move into Section 5, Busting Myths That Harm Women's Sexuality, where Dr. Anabel dismantles the vaginal orgasm versus clitoral orgasm debate, addresses shame, and shows how pleasure can evolve over decades. Section 5, Busting the Most Harmful Myths in Women's Sexuality. Dr. Anabel stands beside a whiteboard with the words myth versus fact written in bold. One of the most damaging myths I hear from patients and from outdated cultural messages is this: a real orgasm is vaginal, and clitoral orgasms are somehow less mature or less meaningful. Let's get something straight. This idea is not only outdated, it's biologically incorrect and emotionally harmful. The science reality doctor, Anabel, gestures to a diagram of the clitoral network. The clitoris is the primary sexual pleasure organ for people assigned female at birth. Period. It contains over 8,000 nerve endings, more than the penis, and its only function is pleasure. Even what some people call a vaginal orgasm almost always involves the internal structures of the clitoris being stimulated indirectly. MRI imaging studies, like one published in Clinical Anatomy in 2011, reveal that the internal clitoris, urethral sponge, and anterior vaginal wall are all interconnected, forming what researchers now call the clitorethrovaginal complex. This means that vaginal penetration without touching or indirectly stimulating the clitoral network is far less likely to result in orgasm for most women. Why the myth exists? Dr. Anabel, this myth goes way back, even to Freud's time, when clitoral orgasms were labeled immature and women were told they needed to graduate to vaginal orgasms to be considered normal. This misinformation seeped into media, sex education, and even some medical training for decades. The result? Countless women have been left feeling broken, ashamed, or disappointed in their bodies, when in reality their bodies are functioning exactly as they were designed to. The data speaks, Dr. Anabel picks up a research summary. A large survey published in the Journal of Sex and Marital Therapy in 2017 found only 18% of women always orgasm during vaginal intercourse. 36% rarely or never orgasm from penetration alone. 94% said they orgasm more reliably with clitoral stimulation. That's not dysfunction, that's human biology. The problem is not the body, the problem is the myth. Practical reframing, Dr. Anabel. Here's how to flip the script. Instead of measuring sex by whether orgasm happens from penetration alone, measure it by how much pleasure, connection, and safety you feel. Explore positions that allow simultaneous clitoral stimulation, for example, the coital alignment technique, or using a small pillow to change the angle of penetration. Embrace outercourse, manual touch, oral sex, toys as equally valid forms of intimacy, not just warm-ups to penetration. Dr. Anabel leans forward, speaking directly to camera. Pleasure is personal. There is no gold standard orgasm. The only right way is the way that feels good to you. And every path to pleasure is worth celebrating. Section 6, bringing it all together. Dr. Anabel sits back down in her chair, voice warm but resolute. We've covered a lot. Anatomy, hormones, the pelvic floor, the mind-body connection, and myths that have been holding women back for generations. Here's the truth I want you to carry with you. Your sexual response is a whole body, whole mind experience. Hormonal changes don't mean the end of desire. They mean your body needs a new kind of support. The pelvic floor is your hidden ally, but only when it's balanced between strength and release. Your brain is your biggest sex organ. Safety, trust, and relaxation are the soil where desire grows. And clitoral pleasure is not optional or secondary. It is central to most women's sexual fulfillment. Dr. Anabel smiles. If you've been feeling disconnected from your body, know this. Your pleasure pathways can be reawakened. Your nervous system is adaptable, and you are worthy of intimacy that feels not just physically satisfying, but emotionally safe and deeply connecting. You deserve to know the truth about your body. You deserve to feel at home in your body. And you deserve pleasure without shame, without apology, and without anyone else's definition of what it should look like. Next, I can expand into Section 7, Dr. Anabel's step-by-step pleasure reset plan, which would give a multi-week progressive science-backed guide women can follow to improve arousal, sensation, and orgasm quality over time. Section 7, Dr. Anabel's Pleasure Reset Plan, a gentle, progressive program designed for women at any stage of life. Dr. Anabel stands next to a flip chart labeled 4-Week Reset with simple illustrations. Dr. Anabel. When women come to me saying, I just don't feel like I used to, I give them a structured approach to slowly rebuild connection with their bodies. Think of it like physical therapy, but for pleasure. Week 1, Awareness without pressure. Goal, reconnect with your body in a judgment-free way. Daily practice, spend 5 to 10 minutes exploring touch, not for orgasm, but for sensation. Use different textures, temperatures, or even a warm compress to bring awareness to your skin and intimate areas. Mind focus. Notice how your body responds to slowness. Keep breathing deeply into your belly to engage pelvic floor relaxation. Week 2, blood flow boost. Goal, improve circulation to intimate tissues. Daily practice, light physical activity like walking, yoga, or gentle squats to enhance pelvic blood flow. Bonus, try warm baths or a heating pad over the pelvis before intimacy to encourage tissue engorgement. Mind focus. Begin to notice subtle shifts in sensation as blood flow improves. Week 3, mind-body connection. Goal, train your brain to stay in the moment. Daily practice, use a 10-minute body scan meditation before intimacy, focusing on how each part of your body feels. Partner tip, share one positive, specific piece of feedback during intimacy. It reinforces safety and connection. Mind focus, replace self-criticism with curiosity. Week 4, integrated pleasure. Goal, combine physical, emotional, and mental readiness. Daily practice, alternate between solo and partnered sessions, using what you've learned about your own pleasure map. Technique, experiment with positions or movements that allow clitoral stimulation during penetration. Mind focus, release the idea of a goal and enjoy the process. Climax becomes more likely when it's not pressured. Section 8, final words from Dr. Anabel. Dr. Anabel sits comfortably, hands open, voice warm. I want you to remember something powerful. Your sexual health is part of your overall health. It's not frivolous. It's not selfish. It's a vital expression of your emotional, physical, and even immune well-being. If you've been feeling disconnected from pleasure, whether because of hormonal shifts, past experiences, stress, or misinformation, I want you to know that reconnection is possible. Your body is not broken. Your desire is not gone forever. And intimacy at 50, 60, or even 70 can be deeper, richer, and more fulfilling than it ever was before. Because now it comes with self-awareness, wisdom, and a refusal to settle for myths or shame. So give yourself permission to explore, to ask questions, to communicate openly with your partner or with yourself, to seek medical support if you need it, and to celebrate every step you take toward feeling fully alive in your own skin again. Because you deserve pleasure, you deserve connection, and you deserve to know the truth about your incredible, capable, beautiful body.